Am I a good candidate for lower bag removal? If so, what type? Is it done the same time as revision or are they separate surgeries? I'm 3 months post-op upper eyelid surgery. I have different eyelid widths and very uneven looking eyes, and I'm not happy. Before surgery, I had slight hooding on both eyes. I'm willing to wait 12 months to see if I improve. My question is, at that time, would I be a good candidate for lower bag removal if they do a revision on the uppers? These bags bulge as seen in pictures. The wrinkles don't bother me as much as the bags. I'm afraid to have more scarring, and I don't want another incision near my eyes.
Thank you for your question. Your question is about having had upper eyelid surgery approximately 3 months ago, and you don't feel fully satisfied with the results, and you're asking at that time, is it okay to reduce the bags or address the bags under your eyes, and then through what approach? And if you do, and assuming that you're going to do a revision surgery at some point. All right, well, let's start with addressing the first concern about the upper eyelids. When you talk about any procedure, in particular eyelid surgery, in the beginning, on upper eyelids, you can see a variability in the difference between the eyelid crease, some swelling. All of these factors have an impact on where things appear on the final point when it's fully healed. And so when is that fully healed point? Well, generally I'll tell my patients that I like to take my after pictures around 6 months. For most people, around 6 months is advanced enough healing process time that allows for swelling and tissue remodeling and maturation to occur. Now, some people who have history of sinus problems, allergies, smoking, and even if they're around secondhand smoke, can still need more than 6 months, typically a year. That being said, you will be able to tell with your doctor if it is right for you to go ahead with the revision procedure if you need it at the point that your doctor feels that enough stability is there so that procedure can be done predictably. I always tell my patients that if you try to work on tissue that's swollen in the area where millimeters matter so much, then you can't be precise. So when you work on tissue that's not swollen, you have better predictability. So now let's address the question about the lower eyelid bags and what approach. Well, judging by the photos you submitted and the activity on the fine lines that are under your eyes, I think it is probably reasonable for you to consider having a transconjunctival blepharoplasty. Now that procedure basically means that the fat pockets that have pushed forward, and it's referred to as herniated fat, can be addressed through the inside of the eyelid. You expressed a concern about not wanting any more incisions near your eye. And although incisions are near the eye is an important aspect of how I discuss the options with my patients, for many people who don't have truly excess skin, there is no reason to do the procedure from the outside of the eyelid. If someone does have excess skin, we can actually do a combination of the inside and do a skin pinch on the outside. But in your situation, doing a lower eyelid blepharoplasty using the transconjunctival approach will probably be acceptable to reduce the fat pockets. In my practice, in situations like yours, I would typically also do some kind of laser procedure, such as a fractional CO2 laser, as well as the use of platelet-rich plasma to help with skin quality. It's very important to understand there's a distinction between redundant skin or excess skin being responsible for wrinkles and skin quality or thickness being responsible for wrinkles. Too often, well-meaning doctors will take away skin to try to improve wrinkles with the unfortunate result of something called lid retraction or ectropion, where the eyelid pulls down or pulls outward. So I think that it's reasonable for you to consider that as an option. Of course, I can't truly judge the degree of redundancy or excess or skin quality without actually a physical exam, but certainly by your photos, I think I can make a pretty good estimation. So in summary, I would wait before you consider having revision surgery because you're only 3 months after surgery. And yes, you are a candidate for lower eyelid blepharoplasty done from the transconjunctival approach based on the photos you submitted. I hope that was helpful, and thank you for your question.